Well, hello there. As a cosmetic doctor, I get asked the whole time certain questions that come up time and time again. So I thought I'd use this time to talk about some of the common questions that we get as cosmetic doctors and nurses. And one of the first questions that you get the whole time is, will I bruise? Well, as I tell patients, anytime you're breaking the skin of a needle, there's always a chance of bruising. With wrinkle injections, the chance is about 10%, and they tend to be quite small. With something like dermal fillers, the chance is maybe 20 to 30%, and they tend to be larger. It's more of a nuisance though. Nobody likes a bruise, but it will go away. And the second question that comes up a lot, this question up here, is why are there different kinds of wrinkle injections, and which are the best ones? The short answer is that there's actually many different kinds of companies that make wrinkle injections, and it's hard to compare units from one to another. In Australia, at the time of this video being created, there's 3 types of wrinkle injections. There's the European kind, the American kind, and German kind. Because of rules and regulations in Australia, I can't actually mention the names of them, but they're all very good, very safe, and you can get similar results from all of them. I tend to prefer the European one because you need less volume for the same effect, but really, a good doctor or nurse can get you good results with any of these 3. And the last question that I'm getting quite a lot, and it's a big one, is this question over here. And that is, can you go blind from dermal fillers? Short answer is yes. There are risks with every procedure. Even having a blood test carries risks, and the more invasive you get, the more chance of any adverse reactions. And dermal fillers can block arteries, particularly in that T-zone central area. There's a lot of arteries you really don't want to hit, and it can block that artery. That can cause necrosis, which is skin death, or it can even cause blindness if it gets into the ophthalmic artery. That's a medical emergency, very serious. Fortunately, very rare, but it can happen. So it's imperative, whoever you see, make sure that they know what they're doing, they've had a lot of experience, and they have a medicine called Hyalase, which is fortunately something you can use to dissolve it out and rescue if there is this complication. Well, thank you very much for your time, and if you have more questions, feel free to message below.